Hey, welcome to Medicare 101. This is Randy Bond with Bond Insurance Solutions in Fort Smith, Arkansas. Hey, if you're here, you're probably looking for answers on how Medicare works, what the costs are, and how you can save the most money. So we have put together a series of videos, hopefully to give you some simple explanations of all those kind of questions and maybe a few more. So let's get started. Today we're talking about how Medicare Part A works. This is our Medicare 101 series, and this is part two. Medicare has two main parts, Part A and Part B. And so today we want to talk about Part A. So let's talk about how Medicare Part A works. Medicare has two main parts, Part A and Part B. Part A helps to cover your hospital costs. Part B helps to cover your medical costs, like your doctor visits and so forth. First, some good news about Part A. Usually, you don't pay a monthly premium to have Part A hospital insurance. Normally, you've earned that through your working years. However, if you have not worked enough, then you may have a premium that's associated with Part A. But for most people on Medicare, there is no premium for Part A. So that's some good news. So there's two important things that I want you to know about original Medicare. Number one, Medicare was never ever designed to cover all of your costs. There's always been, since the very beginning of Medicare, cost sharing. The second thing that you need to know is that Medicare does not have any limit on how much cost share can come your way. So we'll see that as we talk about the cost here. First off, let's talk about what Part A covers. Part A is your hospital insurance. So this is typically your inpatient kind of care. So that's inpatient hospital stays, inpatient mental health stays, and that would also include your skilled nursing facility. So that's typically your rehab after surgery. So you've been in the hospital for a few days and you go for a rehab to get better and then come home. Part A also covers your hospice care. Hope you never need that, but if you do, that is covered by Medicare. So how much does it cost? So if you go to the hospital, for instance, as an inpatient, this would not be outpatient surgery or things like that where you're in and out in the same day. This would be for your inpatient kind of events. Now, if you go to the hospital and you're checked as an inpatient, you have a deductible of $1,408. Now, the good news is that's $1,408, whether you're in there for one day or for 60 days. So that $1,400 is going to cover you up to a 60-day stay. Now, that's a single stay. So if you are in the hospital and then come out and go back in, you could be paying for that next stay. And we'll look more at that in just a moment. Now, if you have a longer stay, so once you hit day 69, day 61 through 90 is going to be $352 per day. And then if you have an even longer stay, a really long stay in the hospital of days 91 up to what days 150, then that would be $704 per day that you're in there. So all of these costs are how much the hospital would send you a bill for. So first 60 days, it's $1,400 that you would get a bill for. If you had a longer stay, it'd be $1,408 plus a daily amount of $352 per day in addition to that $1,400. So let's just talk about that deductible first off. Well, a deductible is the amount that you pay to the provider. So in this case, like the hospital, before insurance kicks in. So that $1,400 is going to be what you would pay for those first 60 days. Again, that's not per day, but that is per stay up to 60 days. So whether you're in there for one day, 2 days, or 50 days, or 60 days, the bill that you would get from the hospital would be $1,408. But I want you to note that on that deductible, that's not an annual deductible. That is a deductible that can repeat several times over the year. Medicare has what they call a benefit period, and that benefit period is 60 days. So what that means is that if you go into the hospital, you have a 5-day hospital stay, and then you come out and there's 60 days at least before you go back into the hospital again, that deductible resets, and then you would have to pay, if you went back into the hospital again after 60 days, another $1,408. So just understand, that you could actually pay that Part A deductible 5 or even 6 times in a year, depending on how many times you went in and how long you were in for and the gap in between. So, conceptually, it could be 6 times that you pay that, but that would be highly unlikely because you would have to hit the calendar just right. But what I do want you to see is that you could pay that deductible multiple times in a calendar year. So going back to your cost sharing, once you have met that deductible period, that's when you get into the daily copays that are added on top of that. But I want you to notice that last box on the right there, the lifetime reserve days. This is where it gets a little bit different. On the days 1 all the way up to 90, you've got an unlimited amount of coverage that you can have when your hospital stays are less than 90 days. So that means you could have many, many hospital stays, and I hope that's not the case for you, that are 90 days or less, and Medicare is going to cover you. But I want you to see the lifetime reserve days there. That's a very important thing that you need to be aware of. Medicare gives you like a bucket of 60 hospital days that you can use over your lifetime for really extended stays. That's those 91 plus day stays. So you're never encroaching on the lifetime reserve days when your hospital stay is 90 days or less. You're only dipping into the bucket, taking out those days or those yummy pieces of chicken there when you have hospital stays, single stays that are 91 days or more. So this is not adding up days. This is where you have a single stay where you're seeing the same doctors and nurses in the same hospital over and over, basically for that 91 plus days. So you're in the hospital, you don't come out for at least 3 months. So each day that you stay is going to subtract forever a day out of that bucket. So those lifetime reserve days can either be spent all in one stay, where you have a stay that's 150 days, so about 5 months that you're in the hospital. You could use up all your lifetime reserve days in one stay. Or you can use those up periodically or over several different stays. So if you had 100-day stay, you're going to take 10 of those days out of that bucket, and you've only got 50 days left for the rest of your life. And then you go back in, you have a 120-day stay. So now you've taken out another 30 days out of the bucket, because remember, it's days 91 and following that are taken out of that bucket that hit that lifetime reserve days. So you had the 10, now you've taken out another 30, that's 40 total. You've only got 20 left for the rest of your life. So there's no limit of stays, and no limit of coverage for stays of less than 90 days. But if you have a really long stay of 91 plus, you're going to start taking out lifetime reserve days out of your bucket there. Nobody wants an empty bucket, because when we get to the empty bucket, you're going to be responsible for 100% of all your inpatient hospital costs from that point on. And so just be aware, that's a risk. Remember, Medicare has no limit on your cost sharing. And so if you had a 100-day hospital stay, you're going to get billed that $1,408 for the deductible, $352 per day for those days 61 through 90. And then you got the days 91 through 100 in this example that you're getting billed $704 per day. But if somewhere in the course of your life you've suddenly exhausted all of your lifetime reserve days, you're now paying 100% for your hospital cost. So that's on the hospital side. Let's talk about skilled nursing facility. So a lot of times when people go into the hospital, they might have to go in for some kind of physical therapy or something afterwards. You have open heart surgery or a knee replacement, and you're having to learn to walk again or recover from the big surgery. Good news is your first 20 days are fully covered by Medicare. You pay zero copay per day, and there's no deductible for that portion of it. Once you hit day 21, you'll pay $176 per day up to day 100. After that, you're on your own. So word to the wise, is work really hard when you first get put in there. Don't treat your skilled nursing facility stay like a vacation, but turn on the eye of the tiger and pretend like you're Rocky Balboa and get out as quick as you can, because once you hit day 21, it's $176 per day. So a lot of people want to know, how can I cover that? How can I offset those costs? There are some different ways that you can do that. Number one is a Medicare supplement. The second possibility is a Medicare Advantage plan. Those work differently than original Medicare, and we'll talk about those in another video, so stay tuned for that. And a third possible option is a hospital indemnity plan. Those can kind of go alongside and help pay for some of your hospital costs. Now, in order to enroll in a Medicare supplement or a Medicare Advantage plan, you must have both Medicare Parts A and B. So those are some possible ways to help offset your costs. And if you want to know more about Medicare supplements or Medicare Advantage plans or prescription drug plans or anything related to Medicare, you can hit that contact us button up there, shoot us an email or give me a call, and be glad to do that. I can do one-on-one appointments if you're in the local area, or we can do that as a video meeting by Zoom or some other platform if you're more comfortable with that. I am a licensed Medicare agent, and I'm licensed in Arkansas, Oklahoma, and Texas. Now, if you're outside that area, I'd be glad to help direct you to somebody who might be able to help. You can just send me an email and we can see if we can find somebody for you. But if you're within that area, be glad to do what I can to help you out. Now, I am not affiliated with Medicare. Medicare agents are generally not, or any other government. I'm an independent agent. I work with all the companies, so I'm able to kind of see the broad spectrum of things that are available in your area and help you find the best plan for your situation. So if you think we can help you out, or if you have some other questions, feel free to contact us or check out some of the other videos that we've got, and we'll put some links so that you can get some of the information that you need below. Hey, thanks for joining us. Stay tuned, or click that button up there, and we'll take you over to how Part B works. Hey, thanks so much for joining us. Look forward to seeing you next time.